Samuel was born to a woman with drug and alcohol issues. Over his childhood, he has been diagnosed with fetal alcohol syndrome, autism, ADHD, developmental coordination disorder, sensory processing disorder, obsessive compulsive disorder, oppositional defiant disorder, and a moderate intellectual disability. He kind of has everything, says his mom Denise, who adopted him at age 1. In an effort to protect their identities, the names in this chapter have been changed. Specialists had cautioned Denise not to expect much, that Samuel would likely miss many milestones. All along, we were told he'll never read, he'll never be toilet trained, he'll never ride a bike, she says. Denise admits they were struggling. Samuel had attempted the mainstream school system in kindergarten and grade 1, but even homeschooling with a one-on-one educational system was getting to him. He was increasingly violent towards his mother, hitting her and even trying to push her down the stairs. She had to restrain him multiple times a day, sometimes for over an hour at a time, she recalls. The fear was that he may have to be institutionalized, she says. Denise didn't want to give up on him quite so quickly, though. She had watched him get over hurdles that everyone had predicted he wouldn't. She thought he might be able to get past this too, but she also had 3 other children with special needs to think about. All had been born to drug or alcohol-addicted women, and all were facing significant challenges. At the point when Samuel was first recommended for vision therapy, around age 9, his mom didn't think he was ready, behaviorally or emotionally, to benefit from it. He couldn't sit and focus on anything for that long. He couldn't even go on a 10-minute walk with 3 aides, his mother recalls, so she put it off. Meanwhile, her daughter Sophia, who was just a bit younger and had also been recommended for vision therapy, was struggling in school. She had recently been diagnosed with both dyslexia and dysgraphia, a writing disability. It was an hour's drive from their home to the therapy, and Denise decided that if they were going to make the commute, that the 2 kids should do the therapy at the same time. She waited for the moment to be right for both. Luckily, that happened within a year. It was like, she can't wait any longer, and I think he can do it, so let's try. She wasn't at all sure the therapy would help Samuel, but she decided to give it a go, and it did help. Samuel started the vision therapy program as a 10-year-old operating at a preschool reading level. After a year of therapy, he began to read for real. He's full on reading now, says Denise, who estimates he's able to read at a grade 1 level. It has been so significant for him. Perhaps, even more importantly, he is also now able to do sports, and not just the bike riding she was told he'd never master. He's now doing intense hours-long hikes and even playing tennis. Here's the message I most want to get across about developmental disorders and vision. Just because there are other things going on doesn't mean vision isn't a part of the mix. Visual issues need to be investigated. When I test a kid who has a developmental diagnosis, I try not to let the diagnosis distract me. What I need to find out is if there are visual issues, because if there are, and I can alleviate them, then at least I'm improving their visual function, and that's going to help them out with everything else. The part that kills me the most is that there are so many kids where obvious visual issues get chalked up to something else. Too often, people tend to assume a child is not reading or writing or not playing sports because of their primary diagnosis. People say, that's just autism, that's just developmental coordination disorder, that's just fetal alcohol syndrome. For instance, and head injury patients can identify with this, often when you have visual issues, it's uncomfortable to make eye contact with people. The background tends to swim, and it doesn't feel good, so you kind of avoid doing it. I get a lot of parents who notice, after their kid has had vision therapy, that the child has started making more eye contact with others. All along, that was considered to be part of the developmental syndrome, and now they realize it was a symptom of poor vision. Please don't assume there aren't visual issues. You have to rule them out. To be clear, I'm not going to treat a kid based on the complaint that they're not making eye contact, the same way I don't treat someone because they're struggling with reading. That doesn't fall into line with my testing and treatment. I only treat someone if they have visual problems that might be underlying those symptoms. But as I said, too often these symptoms have been wrongly attributed to a developmental issue and never even looked into. In my opinion, and not just mine because the Diagnostic and Statistical Manual of Mental Disorders says it too, you should not diagnose a developmental syndrome, including dyslexia, as a permanent disability if a child has untested or uncorrected visual issues. Those should be ruled out first, but that's almost never done. Because, guess what? Those visual issues will have skewed your results. If a child can't track a ball or make eye contact, yes, it may be the consequence of the syndrome, but it may be an even more direct result of visual impairment, something we can actually fix. It breaks my heart to see kids just written off this way. It's especially important, in my view, to be careful in diagnosing developmental coordination disorder. By its very definition, DCD means a child has not developed proper coordination. But before you can coordinate something, don't you need to know the coordinates? Before you swing the bat or move your foot, don't you need to know what you're aiming for? If things aren't working well visually, you can't possibly calculate that. So why are we surprised when coordination isn't great in kids with troubled visual systems? I'm not saying every case of DCD is visual, although I personally have yet to find a single case where that isn't a significant component, or that every kid who fails to make eye contact does so because he has vision issues. But if these are areas they're struggling with, surely we should be investigating them and trying to fix them. In the end, it wasn't just Samuel and Sophia who came in for vision therapy. Their older and younger brothers, Caleb and Henry, did too. We were able to bump things around a bit so that all 4 siblings could work with their own therapist on the same day in the same time slot. Often what happens is that parents decide to treat only the child with the most severe problems. All the parental attention is on that kid, but once those problems are resolved, the other kids' problems become more noticeable. Denise was able to foresee this and decided to compress all the effort into just 1 year and have all the kids treated at once. Although they hated the drive, she says they never complained about the therapy. They were all amazing. Samuel was hands down the most severely affected visually. His eyes could hardly converge and his tracking was abysmal. Like a lot of kids with those issues, he described his vision as jiggly. That's just the brain not being able to process things properly. With those constraints, it didn't surprise me that he wasn't reading, but I was pretty angry that other professionals had told him not to expect to ever read. Imagine that, a 10-year-old, condemned to thinking he would never be able to read. No wonder he was so frustrated. Samuel's educational assistant came down with the family, not only to help with managing the commute, but also because she was going to be doing the home practice with him all week. Denise did the homework with the other 3. All of the kids were being homeschooled that year. She tells me that they didn't do math all year because they were so focused on doing the vision therapy and on jump-starting reading. I knew that Samuel was going to do well, but I didn't realize how well. He really exceeded my expectations. He's an example of how a kid's life outcome after therapy can be dramatically different. It's true that he matured a lot that year, and that he also felt a lot calmer because his mom had found him a quiet place to do his schooling, and both these things contributed to his improvement. But finally being able to read and finally being able to play sports were major factors too. Sophia had a lot of the same visual issues as Samuel, but they were less severe. She was such a sweet kid. She was also a really hard worker. I think we caught her just in the nick of time. Like Samuel, she wasn't reading yet, despite being 10 years old, but vision therapy turned that around for her. Sophia is now reading just below grade level, and her mom now describes her reading appetite as voracious. Both Sophia and her younger brother Henry went back to mainstream schooling following their year of vision therapy. The oldest boy, Caleb, who started therapy at 12, may have shown the least progress according to his mother, but he still improved a lot. His reading progressed and his academic confidence improved enormously. Denise says it was a grueling year, but worth it. Getting them as far as they can go academically is important to me, she says. She thinks both Sophia and Henry have a shot at university. Her central goal is to get each child functioning as well as they can, she says, even though she knows 2 of her boys will likely never live independently. You want to give them every opportunity. I see a lot of kids with developmental diagnoses. The prevalence of visual problems in kids diagnosed with autism, for instance, is very high. It's no surprise when you think about it. Autism has to do with atypical neural development. And with so much of the brain devoted to vision, it stands to reason vision might be affected. As I mentioned, I also see a lot of kids who have been diagnosed with DCD. Remember Kalen from the chapter on reading? He was on the conveyor belt to being diagnosed with it. His mum, Lara, halted the process. Instead, after doing vision therapy, Kalen got kicked out of special ed. He was reading at grade level, says Lara. Importantly, the symptoms of dyslexia, ADHD, and DCD all disappeared. His is a cautionary tale. For one thing, I've noticed that when kids are labeled, they start to own it. Telling someone they have a disability is serious. For another thing, expectations are sometimes lowered. Instead of pushing a kid to do his best, he may be shunted off to the side and coaxed in a less demanding direction. Finally, if your eyes are messing up your world, of course it's going to hit your confidence. A DCD diagnosis is made when a child isn't acquiring and using motor skills the way we'd expect for their age. They might drop things or bump into things, have bad handwriting, or not be able to use scissors or cutlery, or not be able to ride a bike or participate in sports. But as I said above, the official diagnostic criteria require that visual issues are ruled out. Of course they do. Because how on earth can you do an accurate assessment of a kid like Kaylin who had unresolved visual issues? The answer is, you can't. Kaylin went from failing to straight A's. His parents had to start an RESP. Other kids may show a more gradual improvement, but improving vision can have ramifications beyond what we realize at first. There's one young guy I worked with, and when we treated his visual problems, not only did his reading and learning improve, but he could actually play sports. And not only did he enjoy that, but now, all of a sudden, he was having social interactions at school. Before that, he played alone at recess. No one wanted him on their team. After his treatment, other kids wanted to play sports with him. He developed a friend group. Yes, he still has autism, but now he's not facing visual challenges on top of that. We sometimes don't properly appreciate how important sports and play and fitting in are in a kid's world. I'm going to say it again. Don't assume all of these problems are just the way things are. Please, 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 don't just assume nothing can be improved.